My goal when we talk to patients about exercise and physical activity is what I call the 3 E's. So education, empowerment, and encouragement. Education, tie your conversation to facts or things that your patient might bring up, such as fatigue. Empowerment, focus on what they can do. Something is better than nothing. It doesn't have to be perfect. And then also encouragement. I think that a lot of times, people want to hear that they've done well and something that they've done is going to actually be beneficial because our patients are here for a purpose, which is to live as long as possible and as well as possible. Patients in cancer experience a lot of physiological side effects. I think the most notable one that people recognize is fatigue. And certainly there is fatigue related to treatments, but most of the fatigue that our individuals going through treatment experience is simply because they lose a lot of muscle mass. Patients, once diagnosed, go into treatment, they're not as active overall, their eating habits change, everything changes. And so they will definitely notice that their muscles just aren't as, full. They notice maybe body changes. And so definitely fatigue is the biggest one, but just noticing that muscle change is really common in individuals with cancer, especially undergoing treatment. One thing that's crucial for someone undergoing treatment especially is just to avoid inactivity or reduce inactivity. So if we sit for long periods of time, we not only get tired, but that contributes to that muscle loss. So although I really encourage people to strive to meet exercise recommendations, it's not always reasonable. Not only because you may not feel like it, but you might be sitting in a chemo chair for 6 or 8 hours. Chair-based movement also helps, but if you can get up and walk, go do an errand in your home, do a few exercises, they all really make a difference to how you'll feel overall.